Okay. Hi, I'm Dr. Rich Wodiske, 30-year dentist. Having some hip and back pain and some referred pain down my leg. Have limited mobility in this hip. I can't really put this knee down to the floor or the mat here, whereas the left knee does tend to get down further. This has been restricted for years, probably scar tissue. The other thing is I can touch my toes, but I can't, I can't get much further than that. I've seen people lay their hands down on the floor.
So when the last time you were able to touch the floor?
Well, I can touch the floor,
but it's very limited.
Yeah, but that's just the limited amount, and I've never been able to go all the way down. Never really worked on that.
Okay. So how long do you have in the back pain and the hip pain?
Back and hip pain has been, it's got to be 5 years. And building. I'm trying to limit it, things that I do, such as I quit playing basketball. I do golf and surf, do an occasional run, couple-mile run, and do some light upper body weights. I don't do lower body weights. And those are the main activities that I participate in.
So at worst, how much pain? And you can tell us about the recent episode you had.
Last night, I was having hip and what I think was referred pain right down to my knee, and it kept me up for an hour and a half last night. And it was pretty severe, I would say, on a scale of 1 to 10. It's like 8. So I got up, took a couple Advil, and tried to stretch. Tried to see if I could get this thing to, and I also iced my back and my hip area. And it did seem to get to a point after the Aleve kicked in where I was able to go to sleep. Severe enough that I'm here today and hoping to make some progress with this thing.
All right. So yeah, let's lie on your side. I'm gonna do some here, then the other side. So it's actually a very good sign for me that we're moving on, not stuck in one body part. We treated part and we're going to the next one. Yeah. Let's, is it on? Okay, so let's do that motion again.
This one?
Yeah. How's that?
To me, it feels looser, surprisingly, in one treatment.
Yeah, it's going down. Can you visualize it? I can see it's... Can you feel it going
I
down?
think there is some restriction in the hip itself.
I did not work in the back, yeah.
Yeah.
Can you feel the difference?
Yeah, definitely.
Compared to the other side. Let's do both at the same time. We'll see them. Okay.
Or cross. If they're equal, this one's never been equal to this one, for sure.
Okay.
Yeah.
So where do you feel the tightness now?
I feel like I'm starting to pinch right in the hip area in here.
It's anterior or lateral?
Anterior lateral.
Anterior lateral?
Yeah.
What about posterior?
I don't feel posterior.
Okay, let's stand up and do the bending forward and see how that feels.
Well, that's better. I've got.
You're touching the floor now.
Yeah, I've got.
You're touching the floor.
Yeah,
okay, that's good.
I've got my fingers halfway on the floor now. So.
Okay. Have you ever been having the whole palm on the floor? Your palm?
Not that I recall. I've worked on stretching, but I've never been able to just lay my hands on the floor. But
let's see if we can get it there.
That's almost. I'm just about there.
Beautiful.
That's better than I've ever been.
Yeah, that's awesome. When the last time you were able to do that?
Now I feel like my left side, if you release my left side, I might be able to get all the way there.
Yeah.
That's a lot better.
Beautiful. So let me work on this. I want to work on in the back of that hip, and then we're gonna work on the. So let's lie on the same position.
Okay, sounds good.
Yeah.
Go back here.
Yeah.
Yeah. It may be. Yeah, it definitely feels like I'm not gonna hurt tonight on my knee.
That's good.
It just feels like something's been released.
That's good. Okay. So I'm gonna work on the glutes actually. I want to get there too.
You want me to pull it down further? I'm fine with that.
Okay,
That gives
I'm
you a little
covering
more.
it. I'm covering it. Okay. So,
As long as I feel better, like I feel like I already do. Oh my God.
that's good. I can visually see the fibrosis.
That was part of the area right
I can
there
see
that,
it.
that was hit.
It's sticking out here actually. And right in here. That's the area. I can
Yeah,
visually
that,
see
I
it.
think I landed on that area, you know, when I hit that bike.
Uh-huh. It's not too bad here. It's deep here for this. Get it here deep. I can
that,
really
that,
go
that
to
was definitely part of the injury
Yeah.
area. I felt fortunate that I didn't break
Yeah.
the hip, and I think I hit on the pad.
You're lucky actually.
Yeah,
With that injury.
yeah, that pad in there is part of what protected me. I bounced off it.
Yeah. I'm glad you didn't injury. Like you hit your head or something like that.
Well, I did hit the head. I mean, the helmet had to
did.
be thrown
Yeah.
away.
Yeah. Wow. But
It
you,
was
no
cracked.
concussion or anything. Yeah.
No, no concussion.
Yeah. So.
Shoulder, all you know, lashed and scarred up. I got pictures I could show you if you ever want to see.
Yeah. That will help actually to know.
So I can send you.
You feel that fibrosis.
Yeah.
With this instrument, can you tell how deep I can go? I'm actually can go
You're all
closer
the way
to the bone.
in. You're almost to the bone.
To the bone with this
Yeah.
instrument. It's really neat because I don't have to wear my to use my hand to go that deep, and
Yeah, there's no hand that can do that.
not gonna be effective to break it down. You don't have the hand of iron, and if you
Yeah,
do,
that-
you're gonna cause more trauma to that area because
Or an elbow, maybe.
Yeah.
But you can't control it like that.
you will not have a good control. And I'm actually going very deep, closer to the bone, and getting to the fibrosis, and you can see it in the camera. It's jumped where the fibrosis.
So that bump that you're feeling across there,
Mhm.
that is not muscle. That is fibrosis.
No, it should not be bumpy like this.
It should not.
No, it should be nice and smooth. Yeah, so this is, when we compare it to the other side, it's like the washboard here. It was washboard in here, but now when we work on it, it was smooth. That's the fibrosis that causes uneven surfaces like this. This is not like anatomical landmark that you have.
Yeah, like a muscle itself.
Yeah, this is the attachment where the muscle attachment to the fascial to plastic here. So you have fibrosis where it's attached. Wow. Not too much here, but not too be sore. And you can see, well, it's red a little bit. It usually takes 10-15 minutes, and the redness is up here. Okay, so let's actually try to do the motion again and
both
see
motions? Yeah.
and see if that made a change. So the crossing. Okay, how's that?
I'm telling you,
Mm-hmm.
this type of motion forever has been restricted. This in here, I can feel in my hip forever, and
Mm-hmm.
I'm not feeling the restriction that I felt in the past by doing this. This was, I never liked to sit this way. It was just uncomfortable in this hip,
Mm-hmm.
and now I could really put some pressure on those knees, and really, I'm not feeling a pinching.
Beautiful.
That's
good.
This would pinch.
That's good.
Actually, I'm feeling maybe even a little more pinching on the left side.
On the opposite side that we did not treat.
That you did not.
That was the good side.
That was the better side.
Yeah.
This is less restricted than it's ever been.
Beautiful. Let's see the bending forward. How's that? You went right to the floor.
I'm almost down. I got my
Yeah.
finger. Holy crap.
Your palm down.
Yeah.
Beautiful. When the last time did you do that?
No, never.
How many years?
Years.
Can we count?
Yeah, 61 years.
Oh my God.